Hi, I'm Maggie. I'm a physician assistant here at Midwest Breast, and I'm going to talk to you now about activity restrictions following a DIEP flap procedure. So the recovery time for a DIEP flap procedure is 6 weeks, and during that time, we want you to avoid any strenuous exercise, and we want you to use that 6-week time period off of work to give yourself time to heal and to get better. So during that time, we want you to avoid lifting more than 10 pounds like a milk jug for 6 weeks, and also to avoid big repetitive arm motions like vacuuming and rowing motions, as that will cause you to generate fluid and could delay you getting any drains out. So again, avoid repetitive arm motions for 6 weeks. We also want you to avoid lifting your arm above shoulder level for the first 2 weeks. And also to sleep on your back only. This is very important, especially for this type of procedure, to sleep only on your back for 6 weeks, because we want that tissue to really lay flat against the chest wall as it heals, and to avoid any extra tension on those vessels that have been reconnected during your surgery. It is very important to get up every hour, especially, in those first few weeks when you're home. You may not be feeling great, not want to be getting up out of that chair, but it is very important to get up and stretch those legs, even just to mill around your house a little bit for about 10 minutes every hour, just to keep your legs moving, decrease your risk for blood clots after surgery. Walking is fine, we do encourage that, but that's about the only exercise that we really want you to do during that 6-week recovery period. We would want you to avoid any strenuous exercise like running or jumping or any high impact activity. So again, walking is great, we encourage that, but be reasonable. Your body will tell you when you're tired. So you can go for a short leisurely walk in the neighborhood, but don't go walking a mile, because that'll put a lot of tension on the abdominal incision. And the rule on driving is when you're off of the narcotic pain medication, then you can drive, but you also need to wait till your drains are out. So I would plan on having somebody come with you to drive you to your first appointments during week 1 and 2. So after 2 weeks, if you're off the pain meds and your drains are out, then you can drive. As far as abdominal exercises, we do want you to wait until you're at least 8 weeks or 2 months out from surgery before doing any type of abdominal core exercises. And even then, when you start doing those, we want you to ease into it and really not go, full bore, because the tissue really needs time to kind of adjust and heal. So again, avoid anything that causes a lot of excessive bending or twisting or anything at your abdominal core for 8 weeks. And most patients find that sleeping in their recliner for the first 2 weeks is more comfortable than laying flat in bed because of that abdominal incision. So if you have a recliner, that's great. If you don't, that's fine as well, but we would encourage you to use either a wedge pillow to prop your back up, or to use a couple pillows under your knees to keep your legs slightly flexed so that you're not laying completely flat. And again, that's to take off some of that tension at your abdominal incision.